Madison Gates' informative speech. According to the Multiple Sclerosis Foundation, 400,000 people in the United States have multiple sclerosis. 70 to 75% of those people are women. Multiple sclerosis, also known as MS, affects a large part of society, but what exactly is it? As stated by William A. Sharamata, MD and author of 100 Questions and Answers about Multiple Sclerosis, MS is a disease that affects the central nervous system, specifically hardening the tissue in the brain and spinal cord, but it can be treated. People with MS oftentimes experience different symptoms, which is why doctors have such difficulty diagnosing it. If the symptoms are so irregular, then how do we suspect that we have MS? Some common symptoms of MS are muscle weakness, fatigue, numbness and tingling, bladder dysfunctions, balance problems, and muscle spasms. The most commonly recognized symptom is difficulty walking, but the most common symptom found in patients is numbness and tingling. This is because of stiffening and weakening of the muscles. According to George Kraft and Marcy Catanzaro, authors of Living with Multiple Sclerosis, A Wellness Approach, people with MS experience these symptoms because of the nerve damage along the spinal cord. The farther the nerve path, the more likely a function is to be interrupted. For example, bladder and leg functions are often interrupted because the path is so much further from the brain. MS can be caused by several different aspects, which is why the symptoms are rarely the same from person to person. The question is whether MS is caused by nature or nurture. There are 3 factors that contribute to MS: the environment, immunity, and genetics. According to Dr. Sharamata, people who live in high-risk atmospheres are more likely to get MS. People who live farther away from the equator are also more likely to get MS because they lack vitamin D. MS is described as an autoimmune disease, meaning the body attacks itself when it feels there is a foreign object present. MS is not proven to be caused by genetics, but research shows that if a family member does have MS, you are more likely to get it as well. The true cause of multiple sclerosis still remains unknown. The diagnosis of MS is extremely important for a patient to become healthier because the victim finally knows they can be treated. But how exactly is MS diagnosed? MS can only be diagnosed by a neurologist. After a patient receives both blood test and MRI of the brain, the neurologist may diagnose the patient with one of the 4 following conditions: relapsing remitting MS, secondary progressive MS, or primary progressive MS. When diagnosing, the neurologist looks for 2 or more areas of destroyed myelin in the central nervous system. After the test results have been assessed, the patient may then be diagnosed with MS. In 2007, a family friend was diagnosed with multiple sclerosis, and her story touched those around her. At the age of 32, she began feeling a sense of tingling and numbness from the back of her neck to the bottom of her legs. Fortunately, the symptoms only lasted about 1 month before she was diagnosed. Although she has been on medicine since 2007, she wasn't cleared from symptoms until 2012. She no longer has numbness and tingling, but she is still reminded of the disease because she's constantly worrying about the things she can and can't do with her family. With a daughter in elementary school and a daughter in high school, she misses out on more than she would like to, but she knows she is fortunate for the things that she can do. Today, she participates in marathons and gives thanks to her family, her supportive friends, and her great neurologist. She believes she is where she is today because she began treatment at such an early stage. Society's knowledge of MS has come a long way over the past 10 years. With that, researchers have found new ways to treat MS. Some common treatments include symptomatic treatment, relapse management, and drugs. Symptomatic treatment does just that. It relieves symptoms of MS, but has no actual alteration on the process. Relapse management reduces MS symptoms and helps avoid long-term disabilities, but also has no alteration on the disease process. The most effective treatment is drugs. It helps reduce attacks, symptoms, and disabilities. There are many treatments available to people with MS today, and it is important that anyone who has MS takes advantage of those. As stated by William A. Sharamata, MD, and author of 100 Questions and Answers about Multiple Sclerosis. MS is a disease that affects the central nervous system. It hardens the tissue in the brain and spinal cord and causes daily activity to be disturbed. But MS can be treated. If you or anyone you know has multiple sclerosis, take action right away. Remember, early treatment does make a difference.